All right, welcome back, everyone. We are on actually episode 25. I call it season two. I guess I've been at it for a year now, so this has been a nice little creative outlet for me. I've been looking forward to this one. John Sands, John M. Sands, right? Describe yourself. What are you? What do you do?
Yeah. So, I mean, at the end of the day, I am a father, a husband, oral maxillofacial surgeon, and an entrepreneur.
Entrepreneur. Oh, yeah, we're going to get into all that
Oh,
stuff
yeah.
too. Yeah, so you're an oral surgeon, I'm an oral surgeon. So we both went to what, dental school first and then residency, right?
Yep.
But you did a couple more things in residency, and we'll get to some of that in a minute. But did you have, are you from a dental family? Like, how did you even
Yeah.
think about dental school versus anything else?
Oh, yeah. That was a great story. So we had a weird rule in our family. I was the youngest of six kids, and I still to this day kind of joke that my parents forgot to give me the whole college talk. They just kind of assumed that I had it, and I never did. And so
Were you guys on a
actually,
farm?
what's that?
Were you guys on a farm with six
No,
kids?
I know. We were just,
That would have been great.
yeah, Catholic birth control,
No, I know, I know.
So the rule of the family was that you had to pick a career line that was six figures. That was the only rule. You could do whatever you wanted, but
That's a pretty good rule.
it had to pay six figures. And so I had no idea what I wanted to do. And my dad was like, "Well, you're not a super strong student, but you're probably not terrible at math, so you should do accounting." And so
Yeah.
I got enrolled to Washington State University, where I was going to be an accounting major. And
What?
then
At Wazoo?
yeah, yeah.
Are you from Washington State?
No, Northern California. Northern
Oh,
California.
wow.
So
Okay.
then, but he was a prosthodontist, and
Yeah.
probably a whole nother story in itself. But he kind of helped found Clear Choice, and he was
Yeah.
one of the very first prosthodontists of Clear Choice.
Very
And
cool.
right when kind of the Big Short happened in his practice, he sold. Then Clear Choice came too, and he kind of helped get that going. Anyways, long story short, I was sitting there one day, and I always knew he was a dentist, didn't know much about it, but he told me to go get the mail, and I got the mail, and I actually got his paycheck. And
Yeah.
he was like, "Hey, you should go open that." And I was like, "Okay." And I was like, "Whoa." I was like, "What do you do again?" And he was like, "You think that's good?" He goes, "You should see the oral surgeons I work with." And he was like, "Go
Yeah.
come shadow me at Clear Choice." And so
Yeah.
I go into Clear Choice. I've never had any exposure to healthcare of any kind, and they were doing a buy max all on four. And if you've never seen anything like that's a decently involved procedure, and so
Yeah,
they had this
it looks
guy's
super invasive compared
yep
to dental work, right? Yeah.
yeah, and so they had this guy's face open, and I just remember everyone was basically talking about the weekend, listening to music, like nothing was going on. Meanwhile, I
Hmm.
was like, "Is that guy okay?" And then they're like, "Oh yeah, this is like our everyday." And I was like, "Oh, this is
Yeah.
what I want to do." And that was kind of how I got into it. And my dad always joked he was a great prosthodontist, and he was kind of like one of the first. He was very innovative in that field. He was like the first to hop on a plane, like to Mark when the first implants came out, and he had like the first online implant treatment planning software. It was terrible. But
Wow.
anyways, he was like, if I could go back and do it all over again, I would have done oral surgery. And so that was how that whole career line came to be.
So did you end up going to Washington State University then for
No,
undergrad?
no, I had all these plans. I dropped from there, got enrolled in community college where I was going to go
Yeah.
as a feeder school to UC Davis, and
Right.
then met a girl, made bad decisions, moved
Yeah.
to
Yeah.
Montana on a whim, and it ended up being though probably the greatest kind of thing for me. We that whole thing ended shortly once I got there, and I was basically kind of alone in Montana, and I was like, what do I do out here? And then I was like,
Hmm.
guess I better try at school. And then did really well for the first time really ever at school, and ended up meeting my wife and some great friends. And what turned out to be unique was there's very few applicants from Montana. And so whenever I interviewed places, they're like, Montana, that's different. Tell me about
I
that.
forgot that was a state.
Yeah.
It's like they're like,
Yeah.
I forgot
So,
it was Montana was there. Wyoming, Montana. I don't know. So yeah, what's funny because I actually went to Washington State University for
oh,
undergrad.
no way.
Um,
Yeah.
it's like, oh, that's cool. But yeah, that's awesome. So yeah, you went to Montana and decided, after a while of figuring it out that you're going to go into dental school. And so how was that? Like when you got into dental school, like was it like everything you thought it would be, or like were you kind of a little disenchanted, like
Well,
I
so
was?
I was kind of from day one, it was never dental. It was, I want to be a maxillofacial surgeon. That was it.
Oh,
And
from your
so,
early exposure, you're like, I
yep.
want to just go. I want to dental school, and then this is what I want to do. Okay.
Yeah, and so then just being from the Bay Area, I got introduced to University of San Fran or UCSF and then UOP. And then some of my dad's really good friends were practicing in the Valley of Silicon Valley. They had connections at UOP. And so basically the moment I said I wanted to do it, my dad was very smart and he got me put into UOP. And so I
It's a
really
3-year
only
program, I think, right, for dental school.
yeah, yeah. But
Yeah.
basically they said, hey, if you get, this on the DAT, then you're in. And so then I
Yeah.
got that, like literally that, which was thank God. And I got accepted to UPenn, Buffalo, and UOP, and that was the only three schools I actually got into. But I ended
Yeah.
up doing UOP. The thing that kind of burned me, but honestly is what led to everything else that kind of happened in my career was so the way UOP works, like you alluded to, is it's the only 3-year program. And the way that they do that is they take 2 year of science and they put it into 1 year. And
Mhm.
so as a result, though, right around that time, the dental board stopped being graded. It became pass fail.
Pass fail.
And
Yeah.
so oral surgery programs adopted the CBSE. And that was like the second year they ever had the
Right.
CBSE. They probably didn't have it when you
No, they
took it, right?
didn't. No,
They went off
no.
your dental boards, I think,
Yeah,
right?
part 1 and 2, or step 1 and 2, whatever they're called.
Yeah. So
Yep.
when I was there, what happened was all of the Ivy League schools like UPenn and Columbia and all that stuff crushed it because they did med school. And for those of you that don't know, CBSE is basically the prep test for step 1 medical boards. And the
Right.
reason why was because if you were applying to these integrated programs, some would require you to pass step 1 medical boards before you even started the program. And they didn't want to accept people to then have
Like
them not
ours did.
pass.
Ours was like that. Yeah.
Yeah. Yeah. And so that was like a big deal. I remember Shreveport was like, you get accepted, then you have to pass. And there were people that basically lost their spot for that year because they couldn't
Yeah.
pass.
They couldn't pass step 1, which is technically usually the hardest one of the three.
Correct. And so at UOP, we didn't have like any real medical background. And so the only good news was I had good mentors. And so my first year there, I took it and I got like an F minus and realized
Did he
that
get an
like,
F
oh
minus?
shoot, like, and so I ended up studying my butt off for all 2 years. I took it 3 times, and it wasn't until my third and final time that I could take it that I did well. Back in that time, you needed a 60 was like the good number. 65 was great. And I got
Yeah.
a 46, and then I got like a 56, and then I got a 75.
Yeah.
But that actually gave birth to a lot of my study habits, was having to cram for basically med school as a night class while at UOP.
Yeah.
That being
So
said, UOP was phenomenal. Yeah.
You were in dental, this was in dental school you're doing this?
Yeah. So as a dental
Okay.
student, you're doing dental school, but then you had to basically study for med school on the side to get into oral surgery.
Yeah. Yeah. I understand that. And that is the CBSE now, is that pass fail, or is that,
So
I think,
no, technically not, because CBSE is not even a real exam. Step 1 is step 1, and that's pass fail now.
yeah.
But it's kind of changing. Always there's like ADEX now and these
Okay.
different exams. I'm sure you felt this way. I always joke, I don't think I get in if I applied this time around compared to what
I don't know.
people
I think
have these
COVID
days.
kind of messed things up because everyone was virtual for a while. I feel like they loosened the requirements, and just, so that's, I think, what a lot of things, more things went pass fail after that.
Yeah,
But
exactly.
so I don't know. It's hard to say. It's hard to say.
Yeah,
But I'm just happy I don't have to take a bunch of those tests anymore. Honestly,
exactly.
that's a lot I have a hard time sitting through a 1 hour CE course.
Yeah.
It's really like I start doodling. So this is kind of great for people that honestly, like, I kind of went boom, 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 like college, dental school, oral surgery. And I didn't take any time off or anything. I know some people, it's hard to get in, and some people, they don't get in the first time into residency or dental school, and they do a year or two of something else, trying to keep trying and trying. And I think your story is great because it does show that it's, if you want something and you keep going for it, what you're really doing is investing in yourself, right? So dental school, graduate school in general, a lot of people, they end up having to take loans or get some sort of financial backing for it. Some people are lucky where they have people, their parents or somebody can help them out quite a bit. But again, it's still an investment in yourself. Like, you have to do all the work once you're in there. And then, if a lot of people, they're on loans and stuff for that stuff, it's expensive. And so you have to pay that back. So you're basically investing in yourself, and you're just trying and trying and trying to get in, and just because you had a goal, and that's great. That's great.
Yeah, and it's such a funny thing too, because I'm sure most people wouldn't do it if they knew what it really took. I remember telling my wife all the time through that, like, people are like, look back and that wasn't so bad. I would always pause and I'd be like, remember how bad this was, because this was rough. We had kids in residency. But on that same note, because of those struggles, it teaches a lot of the work ethic that follows after. So, I would never have learned the things I did about personal finance if we weren't broke as residents, and, all those things. So it's a blessing and a curse. Kind of like you said, you have to really look at it not as, like, why is this happening to me, but like, what can I learn from this as you go through those hardships of each.
Yeah, that's a lot to get through. And so, like, you, through dental school, you're like, I'm doing oral surgery. I'm doing oral surgery. Why dual degree? Does it matter? Did it matter to you?
I came from a really intense family. We had 6 kids, like I said, but all of us were like big athletes. So my brother was a professional tennis player. he grew on to be a very successful, basically like mega investor, CEO kind of guy himself. He founded Sands Investment Group and about 6 other big companies now that are doing very well. And my brother did film, and then my twin sisters were actually full ride collegiate women's ice hockey to Northeastern, and like they did like the whole pre-Olympic track. I was like getting tested for growth hormones as like a teenager for baseball, and then I was like, do I have to do this? And my dad's like, oh, you don't like it? And I was like, no, not at all. And so to answer your question, we always were really kind of trained, like, pick a field, pick the highest level you could in that field, and then kind of go that path. And so for me, it was like, I think I saw the intensity and I saw the dual degree. And for me, it was like, I think I want to be in a hospital setting. And so that's what led to that. It was never, I only applied to 6 years. Again, had I known the time, realizing it was twice as long as my dental school, it never really registered. So that was probably a good thing.
That's two extra years of residency. I mean, at that point, you're head down, you're in it. It's easy to keep going.
Yeah.
People do fellowships after. And so like that's even more stuff, right? I've been performing full arch dental implant surgery since 2012. I started back then with Nobel implants, and I continue to use them today. Getting consistent results over time and seeing these restorations in function over that length of time has basically strengthened my use of the product. You know, there's over 100 implant systems out there. I just choose the one that's been the most consistent for me.
Oh yeah.
So yeah, like that's an amazing path. And you got into residency, obviously. And so what happened? Like, so you helped, or you basically founded an app, right? So tell us what happened.
Yeah, so I'm the founder and CEO of Advancing Residents of OMFS. And currently we're the first app for our specialty. And we're now one of the largest resources utilized for our specialty. So we have about 6,000 users in 75 countries. We've been formally recognized by multiple congresses in different regions, such as like the Gulf Coast Council and the Oman Society. We've presented in Romania and Ukraine, invitations to a handful of others. But we basically accidentally started a company in residency. And the reason I mentioned that was because I never woke up one day and said, I'm going to make this. What happened was I was at University of Maryland, which is an intense program. It's a phenomenal program with some
shock trauma and all that stuff.
Oh yeah. Some of the best, biggest names in our field. We always joked Robert Ord was the chairman at that time, and he was kind of considered like one of the 4 horsemen, like the godfathers of the specialty. It was, it was him and Gali and, Maloro and Tijuana and all those guys. Anyways, I'm sure did you take OMSITE when you were a resident? Was that a thing back then?
Yeah, so, it was a thing.
OMSITE, it's that exam that you take every year as a resident to assess your preparation and readiness for boards. And I remember everyone kind of told me, don't worry, like, especially as an intern, they're not too worried. Just kind of study a little bit. Here you go. And so I kind of went in more or less cold. But I've been a resident for a year. I thought I had at least seen some stuff.
Yeah, working knowledge.
Yeah. So I got a 7%. And
was there a curve? Was there a curve?
I was like, man, if I had put like all C, I would have gotten at least like, probably a 33%.
Probably more than 7. Yeah.
Yeah. And so, but then my co-resident, who was like way smarter than I, got 2%. And probably one of the funniest conversations that I ever could imagine, like in hindsight, was, like Ord, and I think it was Donita Dalaram, like sat us down in a room, and they're like, so you mean to tell us like our future chief class collectively couldn't get a 10% on this exam? And I was like,
were you guys interns at the time?
Yep. Yeah. We were the 2 6-year guys. And so it really got me thinking though. So we, basically I started asking around. I was like, okay, I have taken dental boards. I have taken medical boards. I've taken about 6 or 7 standardized exams at this time. And I've done in the top 15% of the country for all of them. So why did I fail so hard this one? What went wrong? And I sent out a poll to all of my friends, just kind of curious. I said, hey, like, what do you use to study? Have you ever heard of these resources? And I listed things like Peterson's and Atlas, Current Therapy Secrets, Riti, Lamb. I included some websites, and I just was curious, like, what was everyone using to study, and what was the feedback they were getting from their residency programs? And most people responded, because I would like text them personally and be like, hey, I'm trying to just get some info. And it was shocking. Nobody knew. Everyone's like, I don't know, man. Like, I'm just
everyone had their own way of doing it, and just
not even have their own way, but like most just didn't have a way, period. They were like, I open a book sometimes, I get frustrated, then I YouTube it, and then we have some like notes that we pass along year to year of like common PIM questions, things like that.
Yeah, did they have those knowledge updates back then? Those were pretty terrible for a while. Like,
yeah, and there was always like this like folder on the chief's desktop that had just like 20 gigabytes of just like random papers and articles that were disorganized,
random courses and just on PDF. Yeah,
and so So then the biggest one though is that they kind of sent me down in my end of year review, and they said, you're going to go to med school and you're going to go to Gen Surge, and if you come back and you don't turn it around, it's not going to be a good experience for you. There was a big flood that came through Maryland at that time, and it wiped half this town called Endicott almost away. And Dr. Ord lived on the edge of the, like near the river of Endicott. And this was just such a great, anybody that knows Dr. Ord kind of knows like this was just his style, you know. I said, oh, you know, at the end of the meeting, I was like, hey, Dr. Ord, I was like, I just want to make sure, it's like, was your house okay? Were you okay? And he was, oh, yeah. No, we missed the floods. We're safe. And I was like, okay, good. You know, I was worried about you. And he goes, I'd be worried about yourself right now, because that's a pretty big problem. And I was like,
Just pushed it right back on.
Yes. And anyways, so I went off, and I just remember I was ingrained at that time, waking up at 5 a.m., you know, for rounds. Med school didn't start at 8. And I was like, all right, out of all the polls I got, Peterson's Atlas, Current Therapies, and Secrets were the 4 most commonly used books. And I kind of just like laid out, I was like, if I read 1 or 2 chapters a day, I would read all of those books in the next 3 years. And that was just what I started. And so I would show up to our lecture hall at 6 a.m. every day. And from 6 a.m. to 8 a.m., I would read the chapters. And then about 2 or 3 like weeks in, I was like, but how would I show them that I did this? Like, how would I show them that I took the time to read? And so I was like, well, I'll take notes. And as I started to take the notes, I started to make them into PowerPoints. And then what I would do is I would read each book's section together, and I merge it. I would take Peterson's and Atlas, Current Therapy Secrets, and I'd each read
on the same topics.
On the same topic. It was really fascinating because you start to pick up the trends of the books. So I was like, okay, Peterson's, which was dense. That was a dense book. But that was like all the concepts in the huge, like, all right, like what in the how. Atlas was like, are you going to operate? Because here's how you operate. Current Therapies and Secrets was like, you need to pass boards. And when I put them all together, it was almost like one pretty cohesive unit. And I was like, ooh, that's kind of nice.
You're gathering all this information, and you're just kind of putting it into one sort of master thing, basically. I did that too, you know, to a point, but not like you did. But, you know, I would read like condyle fractures here, and then a condyle fracture here, and then kind of figure it out. And then, you know, but it's a lot. It's like you have to find these resources.
Well, that's part of the problem. I had this moment I'll never forget. I was rounding with my co-resident Colin, and I was like, hey, what if we read all of the books chapters on the same topic at the same time? Like, what if we read all the books about condylar fractures, you know? And he's like, yeah, that's great in theory. And he goes, but nobody has that time. No one's going to do that, you know? Oh, yeah. And I just remember thinking, I was like, yeah, but what if we did? Like, what if we could? And I had to moonlight as a resident because I had kids in residency, and
it's nice to let you do that.
It was a big deal because they never had prior.
Yeah.
But Dr. Ord and Dr. Warburn really kind of stuck their neck out for me, which was great. And then just by the grace of God, basically, because I was a West Coast guy, I took Rebs. I didn't take NERBs. I couldn't practice in Maryland. And so I just looked where I could, and I could practice in Pennsylvania. And I just happened to notice that York, Pennsylvania was right on the other side of the state line, in a 45-minute drive. So I just called the York, Pennsylvania Dental Society, and I said, I am a second-year oral surgery resident looking for part-time work. And then Jim Boyle, who's a great guy, very active in the OMFS community. He's actually running for ADA president right now.
Okay.
He took me under his wing, and I worked for him for 4 years. And I always say, and I still to this day, you know, he saved my life, my family's life. So, you know, all my heart and love to that man. But as I would drive every Saturday, an hour each way, I would just meditate and perseverate on this idea of like, what if I could put all the lectures together? And it kind of became my obsession. And my goal always was that I wanted to have this big presentation when I came back from Gen Surge. And that was exactly what I did. So basically, I had 160 lectures. Now, these lectures were just mostly like my merged notes in the photos and the pictures from the textbooks. They weren't cited. They weren't organized. There was typos everywhere. Everything written was original content written by me, meaning that I had taken everything from these books and I had created this merged version, you know, this kind of meta-analysis. But that was it. And I was like, I'm not going to show my program a big folder. I was like, what's a good way to show this? And so I made a website called the PACS Curriculum, and PACS stood for Peterson's Atlas Current Therapy Secrets. And I made this little Squarespace.
Used to merge them together.
Yeah. And so I made this website, and I just put these lectures on the website, and so I showed my program director at the time the website, and she's like, wow. She was like, this is pretty impressive. And I was like, yeah, I did it. And then I told my friend about it.
Can I stay?
Yeah, exactly. Basically, I was like, will you not fire me now? And she's like, oh, you still a pretty sucky resident, but now you've read a little bit more. So then I shared it with a friend of mine, and I was like, hey, man, and this was what was great. I was like, here's the link to my website. And I show it to him, and his name was Taylor Duckworth, and he's my president and co-founder of AROMs now. And he
Okay.
was like, dude, we need to make this something. And so he
Okay.
goes, let me send this out. So we sent it to our friends, basically kind of like the same people that answered that initial poll of the books. And it went viral. We got like 1,000 views in the first week. We got like 10,000 views in that first month. And then one of my attendings actually reached out and he goes, hey, your website's like gaining a lot of attention. He goes, just curious, like, are you an LLC? Have you looked at anything? Because like you're not charging for it, but on that same note, like this is kind of concerning for copyright and you would be on the hook for it. And that really scared me. So I shut it down. And when I shut down the website, Taylor reached out to me and he goes, wait, why'd you take it down, man? And I was like, oh, all these things. And he goes, no. He goes, look, my brother-in-law helps make startups and let's meet with him and let's see what it would take to actually make this a company. And so we got together, and then what really like turned it was two main events. My childhood best friend, best man of my wedding, godfather to my kids, vice versa for him, happens to be a fantastic app developer. And now he's actually a large product manager for a huge software company. And he had always known about what I was doing. And he goes, do you want me to make this an app? Because he had made a few apps at this point. And I was like, yeah.
That's so cool.
And then what we did was we actually met with intellectual property lawyers, and they said, no, everything you've written is yours. Because when you basically, if you read a book and make a Spark Notes, you own the Spark Notes. That's new content.
Right.
And so we had that reviewed and we're like, oh, we're good there. But then they're like, the photos and the illustrations, that's what's going to be your big hurdle. And so I said, well, man, I loved Atlas and I love the photos in Atlas. They're just beautiful. You familiar with that book?
Yeah.
So I was like, shot in the dark. I was like, somebody made these. So I looked in the book, and sure enough, his name was Joe Chauvin. And I looked up his LinkedIn profile, and he's a professional medical illustrator. Mm-hmm. So I just total whim cold called the guy. And I said, hey, you're, as far as I could tell, like in your, end of your career, but I got this idea. And my pitch to him was basically, what is your current fee structure? And he's like, oh, I charge anywhere from $500 to $800 per photo, whatever illustration. And I was like, and then what? He's like, well, what do you mean? He's like, well, then I get reimbursed and that's it. And it's like published by Elsevier and owned by Elsevier.
It's like a flat fee. It's like a flat fee.
Yeah.
Here you go.
And I was like, how does that work for you? And he's like, I mean, sometimes it pisses me off because I find out that it's been used for multiple things and I don't get any of that. And I was like, what if I gave you a part of the company, basically? What if I said, hey, we will forever always give some kind of royalty to Joe Chauvin and most importantly, his family as a legacy, so that for in perpetuity of this, that you and your family receive compensation for what you've contributed to the field. And that was it. He was like, I'm in. And we've been able to do some really incredible things with him. But what happened was he started to whip out these illustrations. And so now the concept of AROMs existed, and we had some incredible graphics to go with it. Yeah. So then we launched in 2021, and we had 1,000 subscribers in the first month. And that was awesome. Pretty incredible. And then it was a slow and steady kind of growth. And people started to point out some pretty serious flaws like, hey, your citations are messy. Hey, there's typos everywhere. And what I always joke is those first 2 years were the we should start a band phase. We like got together, Taylor, Mitch, and I as the kind of the founders of the company. And we're like, all right, like we should do, how are we going to do this? What should we do? But then from there, fast forward, and everything just kind of fell into place. And so now we're in our 4th year of this business. It went from just a app with some lectures. The lectures when we launched, by the way, we only had 6 of the 12 units that were ready to go. And it was the first version. There was about a handful of illustrations, no photos. And it was basically just these large PDFs. Now it's 6 products, right? It's the comprehensive course.
It's clean. I mean, I think I can access it here while you're talking. Yeah.
And so just in the past 3 months, we've released the beta test of a couple of our products, but now it's 165 lectures. The lectures are on their 3rd revision. We have over 1,000 photos and clinical photos, but we've started to build these dynamic ad features. So there's a search feature, there's quick clicks. You can navigate anywhere through the platform. Basically what we said was, all right, now how do we help every stage of training for every person from your intern year to your practicing surgeon? And the reality is that this is a well-established model in other medical industries. We've just built it for OMFS.
Yeah, and this is great. This is so I have the app here. I know this is a pretty ratchet way to show illustrations. It's hard to see. Let me try to focus it on there. But yeah, you have it really broken down into like 12 things like anatomy, cleft, TMJ, cosmetics, path, right? Pathology, reconstruction, orthognathic surgery, even dental alveolar teeth and titanium. So if I just click on teeth and titanium then it takes me to like another 15 things I can click on. Okay.
Mhm.
And let's just say I pick one of those, like, I don't know, let's do some pre-prosthetic surgery. And so like it just goes on and on. And then you can do your own flashcards and make your own flashcards with it, like kind of like dental decks, like we used to use in like dental school. And it tells you like, do you want 25 questions, 50 questions, 100 questions? Like it's pretty intuitive and it's easy to use. So that's really interesting because I definitely wanted to find out how you got into this whole thing. Like, oh, I'm gonna make an app. Like just kind of going through your path is like you did all this work, and then as things go, you're like you run it by other people, you get a different viewpoint. You're like you should put this together and do it. You know, I know this guy. Then this guy's like I know this person. Cold calling an illustrator, and like this is all within a few years. And during this time, you're still a resident, right? You got a family, you got stuff going. You're a busy dude, you know. And
it was my fourth year gen surg year, which all of people pretty much in the specialty know is the worst time of your life. And I was just very unhealthy. I was like losing my hair.
Yeah.
I was overweight. I was just like very upset with kind of how I was. And so I've always had great mentors in my life. And they basically said, you know, you have to define who you are, what you want to be, and carve that into your everyday. And so I started waking up for my fourth year on. I would wake up at 3 a.m. and I would basically do this whole routine in the morning from 3 a.m. to 5:30 a.m. where I would, you know, take care of myself. I would pray, meditate, work out, those sorts of things. And I would work on AROMs for an hour to an hour and a half in the morning every morning. And then I would, you know, brush up on my patients going in round. And so I always used to joke that was that was my, you know, my building phase where this all kind of came to be. Just to kind of go back to what you alluded to. So right now where the app's at, where it's so exciting is because we've had this vision for years now, but it's coming to, you know, you can look up in a lecture or procedure and you can see a step-by-step walkthrough. We even give the retractors to use. We give every variation of the procedure. So for example, like subcondylar fractures, there's about 9 approaches and we describe in detail every approach, the indications, the risks, patient selection, how you figure out, oh, should I do a T-map or a periangular or retromandibular? And then from there though, what we've also started to do is now, hey, here are the papers that you could go, and we've actually read and summarized them. And then here's the videos that are on YouTube that we found, and we've curated it so that you could just go bam, 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 and you could read it, you could see it, you could walk through it.
So that's really cool. So with social media and stuff, like I didn't even really get on social media until after COVID. And so like I didn't even start doing what I show until like 2020, late 2020 or whatever. When I was in residency, everything we learned was pretty much in books. Like you had to read this book was from my residency. This is like an older edition of Secrets, right? Everyone, you know, knows Secrets. And you can see like in residency, I'm like highlighting like a bunch of stuff as I go, right? And it's like it's almost to the point some pages are like most of the page can be highlighted. So, and then it's just crazy. Like this was gold back then, but it's a book. You got to carry it around. But now I know you can get them in digital form probably. And this is another version of it. I got another one later when the new edition came out. These are all the books I used to carry. Like this is not even all of them, but Boards and Wards was another one I had for USMLE. Okay, that's a really good study book. I used the Parkland Trauma Handbook. What I'm telling you is like these are all like physical resources, and you kind of put a lot of this stuff into a digital app that you can kind of click on and find things way quicker. I use the Mont Reed Surgical Handbook.
Yeah,
I have my eye chart still here from, you know, can you see this? You know, blah, blah, blah. You know, surgical approach books, like, right? So everyone knows
everybody always asks, the
Yeah.
two biggest questions we have is what gives you the right to say these things? Like what's in this basically? How did you make this? And the funny part is how I made it is not how I would have made it today with some of the new stuff, even just kind of with the data processing we have of AI now. But to answer the question, it's very simple. I took 8 years and read every book and merged them. And so we had over 12 books. Yeah. And what's been crazy now is what's that?
Everyone knows like these illustrations from dental school and beyond, right?
And so that's the thing is that when people ask, well, you know, it's just these notes, it's like, no, it's an accumulation of all of our most utilized resources. What's great though is this, and this is a core mission statement of AROMs. It is a foundation of education that can be continuously built upon. And what that means is that every one of those books that you showed is outdated now, right? Within 6 months to a year, it's outdated.
And look at
But
this. Everyone knows this one.
oh yeah,
The marks,
absolutely.
the first marks. Now it's like 2 editions, and now it's probably digital.
Well, and
But
even
that thing
that,
was heavy.
yeah.
Imagine carrying that thing around.
So what we've really started to do, and this is where it's great. So you kind of mentioned this earlier. Well, and sorry, just to kind of finish my thought, the two things people ask is, what's in it, and the answer is everything. They say, well, what about Secrets and Peterson's and that? And it's like, no, you got to understand, we've read all of those books and merged them together. But now what we've really done is every month we go through the curriculum, we go through the content, and we say, hey, where are their holes? Where are their weak points? Okay, like for example, this version I'm doing right now this month is trauma, and I don't have endoscopic condylar fracture repair. So we're
Yeah.
going to build out an entire section on endoscopic condylar fracture repair. But then what's really great is you mentioned the other question they say is, well, how do you keep it up to date? So you mentioned that you kind of made something. And what I've really found through this whole journey that's been really cool is that this has been a problem that multiple people have tried to tackle, and everyone's kind of done it in their own way. So probably one of the most interesting people I've gotten to meet over the past couple of years, and we really just met this year, but he just graduated from residency this week. His name's Brian Carr. And Brian Carr, pretty much a few years after I ran into the exact same problem at Parkland, but instead of reading books, he read articles. And he read 1,800 articles during his residency. And he was a smart guy and used PubMed and basically did hit index and citations and found the most important articles. And then he would summarize those articles, and he made what he called soapbox. And he would send out these emails that were summaries of the articles in literature.
Yeah.
And so AROMs actually merged with Soapbox.
That's
and
really
he's
cool.
come on board. And so like one of the products that we just launched is the Landmark Paper Archive. And in that you can find all of the important articles within every topic sorted. And the way we kind of give the analogy is like, right now, OMFS is sort of like the internet before Google. It's out there, but it's hard to access. And so we're trying to break down those barriers of access. But then one of the features that we do is every month, we take 1 week and we take that journal for that month. So week 1 will be JOMS, week 2 is OOO, week 3 is AO, things like that. And then we present newsletters to our users saying, hey, here's a one-liner summarizing every article from this one. Here are 5 articles that we've summarized in more depth. And here's the PubMed links so that you could get more information for yourself. And as a result, we're just trying to drive and encourage engagement and research and people in the community. Because I think all of us, kind of like what you do with this podcast, kind of like I do with AROMs, we are looking for ways to give back to the specialty to make it easier to participate.
Yeah. No, what you're doing is it's a lot. And the fact that you've done it in like a short amount of time is with everything you had going on. It's not like this was your job. Like you had not only like, I know they say 80-hour work week, but it's not really, it's way more than that. Plus you got life and family and stuff. And then you're doing this, right? It's like a lot. That sounds like part of it was a rough time just because you had so much going on. But now like you've gone through the kinks of it and everything, and it's a little bit smoother. The app is clean, it works well. I like it. And I've used it from time to time, and like I've been working for 18 years, like I refer to it. So it's not only, I don't even think it's only for oral surgeons. I feel like, I do get a lot of people on socials, like DMing me, like, what can is this book good? Is this like, they're talking about books. Yeah. And I even years ago, I'm like telling them, as soon as you buy a book, just like you said, it's pretty much outdated. Yeah. By the time it gets like published and everything, that stuff is, basics are good, but I feel like it's hard to buy books nowadays because it's hard to keep updating those things. And you have to do something like this where you guys are continually updating it nonstop, basically.
Well, and one of the interesting parts, so I actually lecture on a topic, innovations of education. And that's a whole fascinating thing in itself, because as a specialty, we're so far behind what other specialties do. And that's actually something more translated into the operating room. So for example, like right now, to become a board certified maxillofacial surgeon, you just have to present a case log and then pass a national board exam. What other specialties are really implementing is these different low to high fidelity haptic simulators where you actually show surgical competence at different stages of your career. So like an example would be your intern year, you have to steer an arthroscopy in a tissue box and show that you know what the steps of a diagnostic suite are with pictures framed on that. Your chief year, you would ideally be popping into a very expensive model that had sort of reasonable anatomy and feel. And then maybe by the time you want to be board certified, you would have a practical where you actually are doing an arthroscopy on a cadaver head. And so that's like an example of what other specialties are implementing that we could be utilizing. And the reason people may say, well, why would you make that requirement? Because I think if you were to give exposure and training in those fields, you would see a much broader scope of practice in our providers. Depending on where you went, you maybe never saw TMJ surgery, you never were trained in it. And so as a result, you don't offer that service because you don't feel comfortable. And so that's really the big mission behind AROMs is we want to kind of advocate for the specialty. And I think that there's a lot of people that want to do full scope, but don't feel comfortable with the resources they have to do it. But within that as well, what we've really learned is kind of like you alluded to, and this is why you do social media. We've completely changed how we learn, right? We are a generation, pretty much anyone after 2005 is 100% digital learning. If you were in the late early 2000s, maybe you had a brief transition period where you're kind of still remember reading a few books. But what we've learned, and this is where it's really important, when you're born and raised after 2005, your early years, your neural network's totally different because you were brought up on screens. And so your response is faster, your interaction is faster. You're not going to read books the same way. And so we look for gamification, we look for interactive user interfaces, and we look for short burst information, aka reels, posts, social media, what everything is on TikTok. And so what you've done, for example, is you've recognized that and you've adopted that to increase your reach. If you wrote a handwritten letter every month about advancements and did a podcast in a written format, you get probably 10 people that read it. But I
still get letters from older practicing specialists, like a newsletter, a quarterly newsletter or whatever they do. I still get those, but they're much older providers. But yeah, that's hard to read now. Like I have 3 unopened ones sitting on one of my desks.
Oh, you'll scan it into ChatGPT and say, summarize it for me.
I can't. It's something I just can't. It's just hard to I'm like, are there pictures in there? I don't know what's in there. But yeah, that used to be the way to go. But yeah, the app is great. So this thing you have, the soapbox thing you had mentioned, you summarize all the papers and stuff. Are you talking like the white paper from OMFS, like the all those sorts of things, and the landmark implant papers? What's in there?
So that's a great point. So we actually have multiple sections. And if you don't mind, I'm going to geek out on this product specifically because this is a huge passion project of mine that Brian's brought to life. So you have to think within any specialty, right? You'll have landmark papers and then you'll have new articles, right? So you have the papers that shape the specialty and then you have what exists today. Just kind of think about this, by the way, because this is something that hit me that really kind of blew my mind. If a paper came out today that said basically this is wrong or that this is going to change everything, right? How would you know as a doctor in our specialty? How would you know that paper came out, right? You have no idea. There's no notification. No one's basically looking at publications. We all believe a lot of people maybe have some bias and, you could tweak certain data. And here's another idea. If you were like, man, I just did 5 of these and I don't know anything about these until I had done these 5. I'm going to publish on this thing. You would really have no idea where we're at with that. I'll give you a good example. Level 3 arthroscopy, right? Arthroscopic discopexy. That's kind of like a hot topic in the TMJ world right now. Do you do it? Do you not? Some people say it's great, reduces your pain and function. Some people say, hey, I did 2-year post-op MRIs and the disc was in the wrong spot again, and we severely altered the joint anatomy. And what we realized is because there's nowhere that we've placed these landmark papers, and because there's nowhere that we have an easy way to access current literature, no one knows where we're at with things. They don't know what's the current standard, and they also don't know what we know and don't know. And so we have a landmark paper archive, and that is the most important articles, right? That's about 80 articles that we've identified. And these are the ones that the rhesus monkey study on down fracture of the Lefort, the ones that truly shaped how we practice today. And then we have 1,800 articles by domain and by subtopic on the current literature. And these are all articles that we basically have read. We say, hey, they have a high citation index. They have a good case study. They have a large patient volume. They have good follow-ups. We've vetted them. And we summarize them. And then what we're doing though, and this is where it's funny because some people would say it's kind of ballsy, but I think it's important, is at the end of these sections, what we're starting to make is the question list. Where are we at in this domain? What do we know pretty well? What don't we know at all? And what does new research need to look like? And kind of our goal and vision is all right, if I'm an arthroscopist, right, if I do, 70 arthroscopies a year, and I am now really starting to play with level 2 interventions, I should be able to go to this place, see clearly what the literature shows and where are the weak points. Like what are we doing? What are we not doing? So that it's not me just making some dumb study that I think sounds good. It's okay, this is some good studies, but they ask these questions. So I'm going to build this next study to answer those and actually advance the field as opposed to just making another case review that's vague and arbitrary.
That's a lot. I mean, that's like in itself like a huge thing, and you're adding that, just adding that to what you already have going on as far as the app goes. Yeah, because board certification now, they've even changed that where you don't have to necessarily take a test anymore. You do continuing CE because they thought they were losing people who weren't recertifying their boards because they had to take that test. There's a lot of flux with a lot of that stuff, but this knowledge base, like this knowledge, you're always going to have to know it, and it's hard. You're right. Like I don't want to order a bunch of books, or like at this point in my career, I'm like, if I need to relearn or learn something new, like it's hard for me to figure out where to get that information. That's why the app is nice. I'm like, all right, well, yeah, they have some information there. There's some sources listed. I can go look, I can follow up with their sources if I want to know more, but definitely the basics and everything are, on the phone now.
So yeah,
which is nice.
Some of the fun things. So we're just getting started with this part. So it was just my best friend helping me code this for the first 3 years. This year, we've adopted a full app development team. So we have 3 coders and they're going to town building the features. But one of the things that we're going to really start doing is basically integrating AI and deep links into the app that will say, hey, you just read mandible fractures. Do you want to read these articles? We've actually made an audio summary of these articles using AI voice generator. Hey, we just noticed that you just got these links here. Would you be interested in reading this? We're also going to tailor these questions for you. So if you're like, man, I just need to like brush up on zygomatic implants or something, you could be like, hey, help me walk through this. And it's like, great, we have these lectures, we have these articles, these videos. Do you want to make a plan for you for the next week for how you'll study this? Also, while doing that, we'll log your CE and then we'll allow you to submit that. Like, that's the direction that we want this app to go.
I mean, that's just the CE component, everything is well worth it. Like I can just imagine back being a resident, with this information now, like you got, you're like a second year, you're going to be assisting on a ZMC fracture for the first time. And you want to go in there with some knowledge base because they're going to pimp you during the case, even though you're not the second assist or first assist even. But whatever you are, like, like you're going to get hammered potentially. Like what's a blood splat in maxilla? What's this, all the basic, all the stuff they always ask. But yeah, you go in, you read a ZMC thing through the app, and then it's something prompts you, hey, do you want to read this on, lateral orbit? Do you want to read this on, oh yeah, I can read that. And like, it's another, 10 minutes. And like you get, it basically like gives you the whole little area that you need to know.
Well, and a big one too is like, a big one is we're trying to also just create some sort of industry standard with things like, let's be honest, you have a YouTube channel, so I know that you've at least at some point looked up a surgical YouTube video, whether it's your own.
Yeah, of course.
But like, and if you look, you'll see you all over it. We curated a list on our surgical video log where we said, hey, listen, we know you all use YouTube. So if you're going to go to YouTube and learn how to do something, use these guys because we vetted them. And like, these are actually board certified surgeons. So for example, you have awesome cases documenting all your dental alveolar. And so pretty much our whole section on how to remove teeth or do these things, I was like, listen, this guy, he's a practicing surgeon. He's got great technique. He's got great videos. And so you're part of that product, right? Which was, and people say, well, how do you guys work that in the company? It's basically like Spotify. Like we don't own the songs. It's public content. We just curated the playlist for you. But that's the idea, is that we have all of these things where it's like, you can read it, you can see it, you can interact, watch it. Every type of learning is built into it, but we want to make it so that, I'll never forget, I did a SARPI as a resident, and in Atlas at that time, the only version, if you've ever read Atlas, like kind of cover to cover, they have a primary way that they teach you, and then they'll mention maybe a secondary way. And so the primary way that they encouraged doing a SARPI at that time was to actually do a mid-palatal flap and to cut through the palate bone through that way, not doing the Lefort component. And I remember coming in, I won't say the attending, but he was like, walk me through the procedure. And I walked step by step, and he was like, do you want a fistula? He was like, why would you do it that way? And I didn't even know that there was an alternative. And, now, for example, if you look up SARPI, we include MARPI, we include SARPI, we include the 3 different versions of a SARPI, activation protocol, pros and cons. And it's just to kind of show that what you were alluding to, which is if you need quick access to information, you can't be selective as to what it is, but you still need to be able to process it in a way. And most of us are going to learn this on the fly. So, you have to be able to quickly reach it. You can't sit there and open one of those books, flip to the page, and then read 4 pages
Oh
really
man,
quick.
my lab coat was full with like when I was back then, like I had like 3 different handbooks sometimes like in there. Like it was and every once in a while you like have to tie your shoe and you bend over and all that stuff falls
Oh
out.
yeah,
Like
walking
cuz
the
you have so
shame.
much crap like in your
Yeah,
lab
tongue
coat.
blades everywhere, and
Everything's like, like, oh friggin' A. And you're like, of course you're getting paged on your third pager.
yep.
Everything's a mess, right? And then like now, like a lot of this stuff's like right there. You have this
Yeah.
anyways. Like you always have it. So I really appreciate you coming on, man. I feel like we can go like another hour or two on just the app alone,
Yeah.
because I'm interested in it. I think it's amazing, and just the fact that I've been practicing for a while now, and just having a resource like this
Oh,
available,
thank
and
you.
even like people that ask me through socials all the time, like, what can I study? What can I study? I don't know how many people I've told them, just look at that app, man. Just like, they ask me about books. I'm like, yeah, but the app is probably where you want to go. So I really appreciate you coming on, man.
Yeah,
Thanks a
absolutely.
lot. Thanks a
No,
lot.
thank you. Thank you for having me. I mean, it's been fun to watch. Like we kind of talked about, we've seen a lot of people come and go with social media, and you've always been so consistent, and you have such a great model and setup, and clearly just good at this stuff. And so I love, I love
It's
watching it. I love doing it with you. And
creative outlet, man. It
yeah,
is what it is. Yeah. So thanks again,
awesome.
John.
Yeah, no, thank you. Very much appreciated.